Hello and welcome everyone. Today our topic of discussion is HIV Western blot. In this video we are learning about what are the different tests that are available to detect HIV and what are the different window periods for each of the tests and how the Western blot strip is made up by SDS page electrophoresis and how to do a procedure of HIV Western blot and how to interpret the result. So let's see. Human immunodeficiency virus is the etiological agent of acquired immunodeficiency syndrome, that is AIDS. The most common immunoassays used for the detection of antibodies to HIV-1 and HIV-2 are the enzyme-linked immunosorbent assays, also called ELISAs, or the rapid test and immunoblot or the Western blot assays, and that are very easy to perform. The confirmatory test is the detection of the viral RNA sequence by molecular technique like PCR. This picture shows the relative concentration development of the different antigens and antibodies against HIV. So first, when HIV infections occur, the HIV antigen is first to rise. After that, anti-HIV IgM antibody is rise rapidly and decrease rapidly. And after the months, the envelope antibodies and the core antibodies are developed. And after the years of HIV infection, gradually antibody titer is decreased and again HIV antigen titer will be increased. This picture shows the time of the occurrence of different events. When the actual infection with HIV occur, it is a day 0. After that, the day 7 to 14, the viral load can be detected by the molecular technique called nucleic acid testing. 95% of the people are positive for viral load within 3 days to 6 weeks. At the day 16, P24 antigen starts to develop. So it can be detected by the 4th generation ELISA test. 95% of the people develop P24 antigen within 1 week to 8 weeks. The seroconversion occur for the 70% of the people get symptoms at the average 7 to 21 days. And 95% of the people within 4 weeks get the symptoms. At the day 28, the 95% of the people will be antibody positive, and that can be detected by the 4th generation ELISA test, which can detect antigen and antibody both. At the day 90, the more than 99.9% of the people develop HIV antibodies and test positive by all methods by 3 months. This picture shows a different window period for the different tests. Like for the NET, the window period is 10 to 33 days. For antigen antibody laboratory test, the window period is 18 to 45 days. And the rapid antigen antibody test, the card method, the window period may be slightly more than all other methods, up to 90 days. Western blot test can be used as a more specific and supplemental assay on the human serum or the plasma specimen found repeatedly reactive using the ELISA. So it is like confirmatory test where once you get the ELISA positive. Let's learn how the HIV Western blot strips are made. The HIV-1 and 2 Western blot is manufactured from the HIV-1 cell line. The HIV-1 viral antigen is purified and then separated by SDS gel electrophoresis. The SDS denatures the viral component and yields the protein which migrate in the gel according to their molecular weight to produce various bands. The low molecular weight component migrate faster and are found at the bottom of the gel, while high molecular weight proteins remain near the top. They are transferred from SDS page gel onto the nitrocellulose membrane, which is also impregnated with HIV-2 antigen, also called GP36, and a control band. The membrane is cut and packed as a strip. To perform the assay, the strip is incubated with the patient's serum or the plasma diluted in the buffer. In the next slide, we are seeing the procedure of how to perform the HIV Western blot. This picture shows in short about the HIV Western blot procedure. First incubation is done with the patient serum or the plasma. The second incubation is done with a conjugation and the third incubation is done with a substrate. After the procedure, we can see the band. This is the flow chart of how the test is performed. Let's see. First, put the strip in the well and add the 2 ml working wash buffer and put the well on the rotary shaker and incubate for 5 minutes. After the washing buffer, aspirate the wash buffer and add the 2 ml of working diluent plus 20 microliter of patient's serum or the plasma on the rotary shaker. Incubate for 1 hour or the overnight depending on the situation. After the incubation, wash with the 2 ml wash buffer into 3 times for 5 minutes each. After that, add 2 ml of conjugate and incubate for 1 hour. Then wash with the 2 ml buffer 4 times for 5 minutes each. Then add 2 ml substrate, incubate for 15 minutes. After incubation, wash with distilled water and dry and read the result. This picture shows how the final interpretation will be done after the procedure. The first picture shows the HIV one where all the bands for HIV antibodies are present. The second strip shows HIV negative where only control band is positive and all other bands are not seen. And the third strip shows the HIV2 positive where all other HIV1 antibody bands are absent but band for HIV2 and control band is present. The second picture shows how the actual band look like after the procedure. And this table shows how to interpret these bands when the various bands are present or sometimes some bands are present or some bands are absent. So how to interpret that result? Let's see. First we have to understand different type of antibodies like envelope, gag and pol antibodies. The envelope antibodies include GP160, GP120, GP41. The gag antibodies are P17, P24, P55 and pol antibodies are P31, P51 and P66. When can we say that the result is positive? So what are the positive patterns for the HIV Western blot? Let's see. If any of the two envelope antibodies are present and any one of the gag or any one of the pol is present on the band with the control band, then we can say that this test is positive. So let's see. In the first scenario, GP160 and GP120 is positive for envelope antibodies and either of the gag or either of the pol is positive like P24 or P17 or P51 or 55 or P31 or P66, then we can say that this pattern is positive. Let's see another pattern. Here the envelope antibodies are GP160 and GP41 and GP120 is negative. Here again any one of the gag or one of the pol can give the positive pattern like P24, P17, P51, 55, P31, P66. So this is the positive pattern. Let's see the final scenario where GP120 and GP41 is positive but GP160 is negative and either of the gag or either of the pol is positive, then this pattern is considered positive like P24 or P17 or P51 or 55, P31 or P66. So these all patterns considered as a positive and the sample is positive for HIV. Let's see indeterminate patterns. In this pattern, only one of the envelope antibody is present and any one of the gag or any one of the pol is present, then we can say this pattern is indeterminate. Here GP160 and P24 or P17 or P31. Next is GP120 or P24 or P17 or P31. GP41 with P24, P17 or P31. And when only one gag or one pole is present, then this pattern also confirmed as indeterminate, like P24 or P17 or P31. So this all pattern shows indeterminate result. The next is when the bands for HIV-1s are negative but only HIV-2 band and the control band is seen, then we can say that this sample is positive for HIV-2. Where only control band is seen and no other band is detected, or only P66 and only 51 or 55 is seen, then we can consider this sample as a negative. And if we do not get any of the band including control band, then we can conclude that the test is invalid and we have to again perform the test. Interpretation point. The HIV Western blot only detects antibodies and it can be negative in the window period. The presence of GP160 or GP120 plus P24 is a strong indication of seroconversion. Some serum samples, due to their specific characteristic, may result indeterminate result using the 1-hour testing procedure. So, such sample must be retested on the overnight procedure to know the exact result of the sample. The most positive sera will react to most of its protein bands, but at the early and the late stage of infection, an HIV infected person may lose reactivity to one or more of the bands. The person immediately after the seroconversion may display incomplete band patterns, but when followed for a period of 2 to 6 months, evolve a complete band pattern. The infected patients with malignancies and patients receiving immunosuppressive drugs may fail to develop positive reaction. P24 antibody level decrease with the time in advanced stage of infection. Since the reactivity of any degree with any of the virus-specific protein identified on the strip is presumptive evidence of the antibodies to HIV-1, and such result indeterminate must be taken as a suspicious and should trigger the repeat testing or the follow-up testing. This is in short about HIV Western blot. Hope you like it. Thank you and see you in the next video. Thank you.